Hello, I'm Jackie Flavin, Customer Insights Leader with Demco, and this is Open Book, our weekly conversation series with industry experts about how they're navigating COVID-19 challenges. Today, I'm joined by Dr. Navsaria. Dr. Navsaria, thank you so much for joining us today.
Thank you. It's my pleasure to be here.
We are thrilled to have you here. So for our audience, Dr. Navsaria is a pediatrician working in the public interest. He blends the roles of physician, occasional children's librarian, educator, public health professional, and child health advocate. Wow, that's quite an awesome list of areas of expertise and exactly what we need right now. You've got graduate degrees in public health, children's librarianship, your physician assistant studies, and medicine. And so you bring a really unique combination of interest and experience together in your work. You're associate professor of pediatrics at the University of Wisconsin School of Medicine and Public Health, director of the MD MPH program there, as well as the medical director of the physician assistant program. You are busy.
Indeed, I am. And for folks who are wondering, yes, I have a lot of student loan debt.
And then clinically, you practice primary care pediatrics with a special interest in underserved populations, which is awesome.
Yeah, I've spent many years in primary care and still involved in ambulatory pediatric work.
Awesome. Yeah, so we couldn't think of anyone better to help us sort through all of the swirl of information out there these days. So maybe just to start off, could you help us sort of process and understand, what does the current research say about children and COVID-19?
Yeah, so the first thing I'll just start by saying is that a lot of information is swirling around. We know a lot more than we did even just a few months ago, and there's a lot of evolution. I think it's very easy to feel like, wait a minute, we don't know anything about this virus. Well, actually, we know quite a bit. Even back in March, we still knew quite a bit. But we're starting to figure out some of the nuances there. So children is really interesting because you can do these one-off studies where they swab children's noses and look at the amount of virus in there and so on. But better than that is saying, let's look at large populations and see where's the virus popping into families from, right? Is it the children bringing it into the household, which I think many parents will be familiar with the phenomenon of their kids coming home sick from school, and then a few days later they become sick. Well, some of the studies, and this is studies done in Spain, in South Korea, and others, again, looking at thousands upon thousands of people, have shown that largely, for the most part, children don't seem to be the ones bringing it into homes. It's actually the other way around. It's actually the adults, probably from workplaces or other contexts that they have to have, that they are bringing it into homes more. Now, there's a few contradictory studies out there that say, well, maybe it's actually really the children and so on. But the largest and best studies so far seem to really indicate that it's children are getting it from others in the household, largely the adults, which is different from what we're used to seeing with most respiratory viruses.
Interesting. And when we say children, is it safe to assume all kids under 18, or are there certain age groups we should think of differently within that?
Yeah, that's a great question, because there was a study that seemed to indicate that young kids, so like under about 8 years old or so, let's say 10 years old, I think was what the breakpoint they used, were less likely to transmit, and that the teenagers, this is their initial finding, okay, that the teenagers seem to actually have a higher rate of transmission, maybe even than the adults. However, then they went back and relooked at the data, reanalyzed, and said, "Oh, actually, never mind. The teens are actually not as bad as the adults either," which I don't think made the headlines quite as much. This is one of the challenges when somebody says new research out. Okay, first of all, is this actually published in a peer-reviewed journal? Has it been looked at and edited and whatever, or is this one of these preprint setups where the authors have posted it, but no one else has looked at it, criticized it, asked questions, and so on. A lot of these things are sometimes preprints, and sometimes the press is terrible at identifying is this a preprint or has this actually gone through review, and so on. And sometimes they're even making assertions about things that are actually completely computer models.
Wow.
Someone sitting on a computer and saying, oh, we think spread from, like, the best example going way back to the spring was, I think from Belgium. They said, oh, we have this model of how the virus spreads from cyclists and runners. It was all theoretical on a computer. No one got out there and measured. No one looked at spread, nothing. But it created this mass panic, which I still see people saying, well, I heard that cyclists, you need to give them 65 feet. No, no, you don't. We have actually no evidence of that. If, in fact, if anything, fresh air outdoors actually seems to be protective. So relax. We don't need to be like going nuts about cyclists and runners. But the harm was done in a sense because there was all these dramatic headlines for something that was a computer model that hadn't even been reviewed. So I think we would all do well to when we hear extraordinary new data or claims or concepts, we should stop and ask ourselves, how well has this been delineated, especially if it's completely opposite to everything else that we have been thinking so far. But extraordinary claims need extraordinary evidence.
That is great advice. Hopefully, we're all learning how to take in information, and also learning how much we don't know. Lay people like me don't really understand medicine, and hopefully, you'll see a spark in kids and adults being interested in going down that path because we're all learning so much
Well,
about how
it's
these work.
it's not just healthcare. It's actually about information literacy, right? So I don't. If I also think kids should consider going to library school.
Yeah, right. I know it should be almost mandated. Um, so what does the virus look like in children? Like how does it affect them when they do have it? There were some really scary headlines earlier in the summer about how it could be really devastating to kids.
Mhm.
What's the real news?
So the vast majority of kids, almost every kid out there, will either have no symptoms or will have symptoms that are consistent with a cold, or at worst something similar to an influenza, where just higher fevers, body aches, fatigue, that sort of thing. Um, that is what we see time and time and time again. Many kids will just have a few sniffles or nothing at all, which is one of the challenges here in terms of preventing further spread. There are a very small number of kids that have a system-wide inflammatory syndrome that is known as MISC, multi-system inflammatory syndrome in children. And there's, of course, more recent reports of possible effects to the brain and nervous system, and or to the heart. Now, let me put all those things in context. First of all, if you look at number of cases of MISC in children globally, we are talking about an incredibly, incredibly tiny number. More kids are killed in automobile accidents in the United States in a year, um, by far, than are affected by things like MISC. So, but we don't think anything of putting our child in a car and driving somewhere, right? So let's put these things into context. Also, we've long since known that all sorts of viruses cause oddball inflammatory syndromes and neurological issues in a fair number of people. I saw it in training all the time, and it's actually largely well known to us in pediatrics. So, yes, scary headlines about encephalitis, which is a inflammation of the brain from, connected to COVID-19. Uh, Guess what? We've actually known about encephalitis related to influenza for decades. It's old news to us in healthcare. I've actually seen kids with actually permanent harm from influenza-mediated encephalitis. Yet, how many families do we still see out there saying, "Oh, we don't get the flu shot. Oh, I don't need it. I'm healthy," right?
Right.
That are often in a panic about these headlines. So again, this can all sound new and scary, but actually, this is actually well known to us, and it's just not news. It's not, people aren't making big deals about it with all these other viruses. So again, I don't want to downplay that encephalitis or inflammatory syndromes that end up hospitalizing you are trivial or minor. They could be significant, and they're awful, absolutely awful for the kid and the family of that kid who can get them. But we're talking about a very tiny number. And guess what? This has actually been here before. in all sorts of ways. So again, I think the reporting on this would do well to say, and by the way, we've actually known about this. I cared for several kids in training who had issues like this. So this is actually not inconsistent with what we've seen with many types of respiratory viruses.
Mm. It's just so hard to compute these things, rationally. And especially, like, I remember reading the headline and think, the first kid had died in I think Minnesota or somewhere.
Hmm.
And I remember thinking, well, I probably shouldn't send my kids to school. And then I had to like talk myself out of that and remind myself, let me think about what I remember from statistics class and all that. But it's just so hard. I mean,
Hmm.
it's always hard, but especially when we're in a heightened state of anxiety.
The fear is very real, and I totally understand that, and I think people would be right to be concerned. I think we need to think about, first of all, what kind of news sources do we choose to look at? There's some news sources which frankly just like to lob these headlines out there, and they hope that it gets people to watch or read or whatever. And it's not really about good quality journalism. It doesn't go into the nuances and the factual information. So I think we can make better choices about what we're choosing and what we're choosing to share with others as
Right.
well, right? Social media and all that business.
Right.
But I think the other piece of this is that we human beings are very bad at assessing risk. We all are. If we held motor vehicles to the same standard as we do medications or vaccines or whatever, my goodness, the waiver that you'd have to sign every single time you get into your car is actually kind of crazy. I've I've somewhat flippantly this is with families that I have a good working relationship with, when they ask me a question like, what's the greatest risk to my child coming in to get a flu vaccine? I've had to say, it's actually that you might get into a significant accident driving here. And actually, if you run the statistics, that's actually completely true. But we don't think anything of that risk.
Yeah.
So I
Right.
think we need to think about how we quantify it and discuss these things.
Yeah, for sure. I feel like I'm going to leave our conversation feeling more comfortable about the pandemic, but nervous to get in the car, which is probably accurate. It is accurate. So what constitutes a high risk child? I've got friends who have kids with asthma, and they're super nervous about letting their kids go out. What should we consider high risk kids?
That's a good question because there's no one set of definitions on that. Certainly, my usual answer for that is have you should take your child to you should talk to their healthcare provider and discuss, are they truly at high risk or not, because there's so many nuances and elements and so on that may or may not matter, that I think it's worth a discussion that's tuned to that child's specific needs and profile and history.
Mm.
I think there's some parents who think their child is high risk and they've actually not been high risk for a while. So thinking of like the child who was being treated for leukemia,
Mm.
right? Okay, if they were actively getting chemo, et cetera, yes, that can really affect your immune system. That's a problem, et cetera. 5 years after treatment's completed, probably not. In fact, some of my oncology colleagues are like, you can stop calling me to check on that. You can just treat your kid like they have a normal immune system. It's been 5 years, and so on. Um, Asthma is an interesting one because actually all the data I've seen is that actually asthma doesn't seem to be a risk factor.
Mm.
You'd think, oh, it's lungs, it's all related, but yeah, doesn't actually seem to be one.
Okay, good to
Mm.
know. Yeah. Um, I'm wondering what you can tell us about the effectiveness of masks.
Hmm. So masks, we've had to flip flop a little bit as a society. Initially, there was a feeling that masks may not be as useful, and part of that also was that we had severe mask shortages, and that was actually affecting us in healthcare to the point that it's one thing to say, and I appropriately, right, stay 6 feet away from people, ideally, isolate at home, all those things, because that's much more effective than actually even wearing a mask or anything else. And we had people just buying up and hoarding like
Mhm.
N95 masks and things like that, which, again, uh, as a healthcare provider, I have to get close to my patients.
Right. Right.
I can't look in an ear without being close to a patient,
Mm.
and so on. Uh, and we weren't actually completely sure about how much of the spread was through air versus objects, surfaces, handshakes, hugs, that sort of thing. We've now come to realize that there's much more airborne spread of this particular virus than we had initially recognized,
Mm.
and we actually have really good evidence. So again, I like looking at big population data when possible because it tells us how does this play in the real world. Uh, One study looked at the states that had implemented a mask mandate
Mm.
and what happened before and after those mask mandates, and then also comparing it to some states that didn't. And you saw massive, massive plummets in infection rates, like simply on the basis of that one policy change. So there you go. When people say, is it effective? Yes, we have mass population data actually telling us this. Are masks perfect? No, they're not perfect, but they seem to reduce spread by quite a bit.
Mhm.
Um, and the other nice part about this is that while I would not go touching public surfaces and touching your face directly without cleaning it, it seems surfaces are less of an issue. So some of this rather crazy initial, we are going to wipe every surface every 5 minutes with 9 different cleaners is massive overkill.
Yeah.
That is really not as big a deal. Again, is it still feasible that you could contract the virus through touching an object that's contaminated? Yes, you could, um, but it doesn't seem to be as much as the spread issue.
Okay. Yeah. Yeah. My father-in-law is still putting his mail in the garage for a week before he touches it with bare hands. Um,
Yeah, and we have no good evidence that the virus really lasts on surfaces longer than 72 hours,
right.
and maybe even shorter. Yes, there's one study out there that says 10 days and stuff like that. A lot of those studies, then you start getting into how did they measure this? Oh, look, we swabbed it and we found viral RNA on there. Well, viral RNA just means viral RNA. Does it mean it's actually alive or not?
Right.
That's one of the issues here is that the PCR tests that those nasal swabs largely are using when we talk about testing are so sensitive. They even find fragments and then flag us as a positive. So because of that, we can't easily tell the difference between was this actual infectious viable virus or is it just dead pieces of virus? And that's why some of these things about, oh well, people can have been infected with it for as long as 21 days. uh, Actually, usually what they're saying is we're finding viral RNA sitting in their nose for 21 days. It may be utterly dead. It may not be a threat to anyone. Um, that's unfortunately why it gets so complicated. Best data we have is on surfaces. Probably about 3 days is fine. And if you wipe it down, it kills the virus even
Right.
sooner.
Right. And even if you do have it on your hand, but you never touch your face and you wash your hands before then you're still safe, right? I mean,
Yeah, intact skin is actually a great barrier to most viruses. So this does not infect through intact skin.
okay, good to know. What can you tell us about the effectiveness of certain kinds of masks? I remember recently there was a headline that the neck buffers might not be a good mask, but then shortly after there was a quieter headline that said actually they're fine. Is there any
Mhm.
information on that you could share?
Yeah, that was an interesting study because it again it was the inside a laboratory spray things, and there were some weird conclusions that people made from it that actually I think the authors of the study said, wait a minute, that's not what we didn't set out looking to see are those gaiters or buffs or whatever those stretchy thin elastic things that athletes often wear. uh, they didn't set out trying to check the effectiveness of it.
Mm.
They were actually simply trying to look at other factors around spread. So when you set up a study to look for something and to test a question and you find something completely unrelated, you should really be asking yourself, is that really valid? Because if your study wasn't looking for that,
Right.
it may not be that you were asking, that you may not have had the right setup, right?
Right.
So the conclusion has been that anything is fine. So look, if somebody's not sure about a mask, because everyone and their brother's making a mask, and of course we're not regulating them except for the medical N95s, blah 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 type masks. Um, The best test, so to speak, is to there's two tests often. Hold it up to the light,
Mm.
and how much light can you see through it? If you're seeing quite a bit of light coming through, that means there's significant holes. The other test, even better, is a lighter or a candle. Hold up the mask and see if you can blow out the candle through it.
Oh,
If you
cool.
can, it's letting air through, right?
Yeah.
And there you go. Versus sometimes some surprisingly thin masks, but they're made with 3 layers of fabric tightly woven, and even putting on the mask and trying to blow, onto your own hand, it's like, oh, I can't feel a thing.
Yeah.
Okay, that's a more effective mask. Even the not so good masks, a 20 to 30% reduction in transmission is already better than no reduction.
Yeah. Okay, that's great. That's really good. Really super helpful to know.
Mhm.
Um, and we talked about spreading the virus in surfaces, and they're now starting to. I've seen some headlines about how the virus may also be in our intestinal tracts, and we should be extra worried about being in the bathroom. And the bathroom can be a really contagious area. Any thoughts on that? Any?
Ah, yes, this is the famed toilet plumes issue. And I'm sometimes like, we're really spending like newspaper space on this. Um, Again, most of these tend to be models that they say, oh, look, these droplets are getting up into the air and so on. So here's the way I think is a good common sense way to think about this. If this is an issue, other things can also be aerosolized, like E. coli bacteria, right? Which is what's a primary component of poop. Um, and we have no evidence that public restrooms of any kind are causing people to have like pink eye or other infections
Right.
because of aerosolized fecal material or whatever. It just does not seem to be a big issue. If you're in a public restroom, you should probably be wearing a mask anyway
Right.
because you're indoors, and I would be worried about the air just like I would be in any other room in an indoor space, right? So that would prevent you from breathing it in, and the chances that it's going to get into your eye, yeah. Now, if it's a really small restroom, you might need to set a limit of one person at a time, but that's because of air. It has nothing to do with the toilets.
Okay.
Uh, yeah, and if you're going to be that worried about it, if it's a library and fine, shut down your library because I would be just as worried about people walking around in your library. If you're gonna focus on the toilet plumes, okay, then your willingness to take on any level of risk for your public is so low that I would argue that you just shouldn't reopen at that point,
Right. Okay.
right? And that's not me saying libraries shouldn't be reopening. It's simply saying um, hand sanitizer by the door, indoor masks, good air circulation is where you should be spending your time, money, and effort, not worrying about your toilets.
Okay. That is so great. Um, this is so helpful and wonderful, and I feel my own personal anxiety level going down just talking with you. So thank you.
Good. You're welcome.
Um, I'm wondering if you think about kids in school, there's so many different ways to do school these days. There's the virtual learning, there's in-person learning, and then the hybrid. Um, there are, risks and concerns for kids for all three of those. I'm wondering if you could share what you see as the things that we should not, I don't want to say worry, but the things that we should be thinking about for kids in each of those types of learning settings.
Yeah, school is, gosh, it's such a challenge to think through, and my heart goes out to the school districts, school boards, to the teachers, the school librarians, the principals, because no school is the same. Even within a school district, there's so much variation between different buildings, class sizes, and let's also keep in mind, right? There's different school districts with different levels of ability based on public financing. How big are their class sizes? How new are their buildings? How good are the ventilation systems? There's an equity issue here too. Let's call that out for what it is. And then also for thinking about virtual learning, yeah, we have the ability of internet and all that. So, we can do different types of learning, even virtual learning. Well, what does that really mean? Is it asynchronous where the students are never on a screen at the same time together with their teacher and hearing things live? Is it all asynchronous assignments, one-on-one communication? Or is it, no, you need to be in a chair in front of your computer. Class is from, 10 a.m. to 10:50 a.m. for, English or whatever it may be. Those are different, very different things. And what is the ability of families or the school districts to help families with adequate internet access, uh, private space? I've worked with a lot of families where children don't have their own bedroom,
Mhm.
right? What about noise around them? There may be other young kids running around screaming and they're trying to focus on schoolwork. Um, do they even have high-speed internet access? Do they even have a laptop, right? Is a kid trying to do this on a propped up smartphone? There's so many different combinations and elements. I think, first of all, we all, school systems, parents, uh, this public in general, we all need to be really patient with each other on this one.
Mhm.
Um, we're being asked to do this even with a few months notice is still really challenging. We need to think about how we can provide support and assistance. Not all families are confident or capable in being able to help their children learn. Okay, and by the way, let's not make assumptions here. My daughter was trying to get through some trig homework last spring. I have not personally had to think about sines and cosines in a very long time. Okay,
Right.
it is not relevant to what I do, and I was having to like remind myself how to do this. Now, the great thing is, right, there's a million YouTube videos explaining this, so we watched a couple together just to help me remember, and then I was able to help her. And then once she got it, she chugged right through it. But right, so great, that's all wonderful, right? But
But even with
the
educational
this
background, it can be a challenge. Yeah. And you might
right,
be so busy that you
right,
don't have like enough time to dedicate to
yeah.
that too. Yeah.
Yeah, and there's some employers who I think are very thoughtful about giving their employees time to do the work to tend to their family's needs and, in homeschooling essentially and so on. And then there's others that are not being so helpful. And those employers need to really stop and think about their values and whether they're making good choices there to support their workforce as much as possible.
Mm. Yeah, it really feels like we're seeing all the cracks that have been in our system for a while and starting to put people first, or we should be. And a lot of people are doing that. And some people might need
Mhm.
to catch up, but maybe we can maybe we can feel optimistic that we're moving in that direction somewhat.
I think that one of the positive effects of this pandemic is people are suddenly recognizing that their coworkers have families
Hmm.
and that their coworkers are also parents and actually and caregivers to elderly and so on and so forth, right? So uh when people are slowly learning, I think, to no longer apologize when their kid comes running in during a Zoom meeting, it's like, yeah, that's fine, right? And I think it's actually making the work of parenting more visible
Yeah,
and recognized, and where it and actually my hope is that it'll actually help us with things like talking about paid parental leave and
right.
leave for newborns and so on in many ways, because I think it's become more visible to a lot of people that may not have thought about it.
Yeah, we potty trained our 3-year-old in the beginning of the pandemic, and her little potty was behind my husband's at-home workstation, and she went potty like while he was on a Zoom call, and his coworkers were like, "Yay, you did it!" I
Yeah,
mean,
there you
I'm
go.
sure they didn't think of him as a dad before, but now they know that he's a family guy.
Right, and again, like, and I'm actually glad you told that anecdote, because I think we've long since talked about the challenges women face in the workplace, of the role of being of doing the job of parenting, which we know disproportionately tends to fall on more on women. But the other thing is, right, like that there's often maternal leave that's been put into place, but paternal leave is like, oh, you get 3 days.
Right.
It's like, wait, what? Well, what if the father's the one who says, no, actually, I want to spend some more time with my child, whatever. It's making fathering also more visible in some ways that I think will have a beneficial effect for everyone in the workplace. Again, to recognize that parenting is important, irrespective of whether you're talking about mothers or fathers.
Totally. Yeah. Very well said. Um, so, what do you think? What should parents do if they know that their child has been exposed to someone who has had a positive COVID test.
Hmm. So the first thing I'd say is call your doctor, okay? Because here's the thing: each municipality has different things going on, right? There's some places where there's not as much circulating COVID. There's places where there's tons of it, and they'll have different recommendations. And your healthcare provider will know what that is, right? Um, Not everything requires being seen. In fact, sometimes, like, do you really want to go and sit in a waiting room and with other sick people for in urgent care or whatever for a couple of hours, right? If you yourself, when you call, just say, look, my child doesn't appear that ill. I'm comfortable with them. But the question is, does my child have COVID or not, or they were exposed? What should we do? Often, many healthcare settings, and again, they're so different, but can say, oh, if you're comfortable, and we'll talk through things. Yep, I agree. That doesn't sound too bad. Let's have you just go through our drive-through testing site because
Right.
that's all we need is a test. If you need to be seen, give us a call, right? But we're not going to make you come in needlessly just for us to say, yep, basically you need a test, go home, right? That's a lot of time and resources and effort for everyone involved. So call and ask because they might say, oh, this was wait, your child wasn't actually exposed to someone, but someone they were exposed to was exposed.
Right.
Yeah, we don't need to test for that unless they turn positive, right?
Yeah.
Um, Public health is going to give that guidance, and so just call and ask, and they will guide you because they're not interested in like creating needless visits
Right.
if that's not what's needed.
Right. Yeah, that is good advice because each situation is so different, right? Like, how was your
Mhm.
kid exposed and who exactly and when? So, yeah, it's hard to give a one, one risk, one solution for everybody.
And I just want to say, there's for the most part, we shouldn't be testing people unless they're symptomatic
Mhm.
or if they had a close contact that was significant, more than 15 minutes, blah blah blah, who is positive. Uh, Random testing is something that people have been talking about, and
Mhm.
they've sometimes done that in like mass populations, like
Yeah. The NBA
uh,
doing that, I
well,
think.
NBA, but actually even like college campuses, right? Like they're saying, okay, we're going to randomly screen staff and students because we're trying to figure out patterns of spread and so on. But it's not about saying we're going to catch it and knock it down because of all these issues we've talked about earlier in this recording that well, hang on, you're positive. Well, have you ever been tested before? No, you haven't. Have you ever had symptoms? No. Okay. Did you actually have this weeks ago and now you just have bits of dead viral RNA?
Right.
Do I now tell you to go isolate for 14 days and completely screw up your life?
Right.
When do you come back? Well, do I test you when you come back? Well, no, when you're done with symptoms. Wait, I never had symptoms. Right. You start getting into this.
Yeah.
We always say in healthcare, right? Don't ask questions that you don't want the answer to. Like don't draw blood randomly and just say, oh, let's see what this is. And you're like, oh, they don't have X, but oh, this isn't what I expected to find, and it's probably nothing, right? And
Right.
so there's a lot of kind of loose talk sometimes about, oh, we should just be doing random testing or periodic testing of asymptomatic individuals. I think that's fine if you're talking about it as a really broad, big public health strategy.
Mm.
That's a different category. But in terms of individual workplaces, libraries, schools, etc., it gets very problematic very quickly
Mhm.
to do that because we don't know what to do with a random test that's positive in an asymptomatic individual who has no contacts.
Right, right. Yeah, a lot of schools have been contemplating rapid testing as a screening tool. Uh, and I was just thinking about how some are doing the temperature check and some aren't. What are your thoughts on that? Is that an effective method for keeping people healthy or?
Fever temperature is one piece of information.
Okay.
If places want to do it on the grounds that maybe you catch someone who has something going on a little early, okay, that's fine. It's quick, it's easy, it's harmless,
Yeah.
as long as we are actually using adequate proper criteria. Um, a fever is 100.3 or higher. When people start saying, "Oh, well, we took a temperature and it was 99, and we said that was a low grade fever," that's not a low. That's no such thing as a low grade fever. Stop. No, that is not a fever. Stop manufacturing an illness where there isn't one. Likewise, I had a question once. Oh, this child coughed once. Is that is that a concern? I said, no, people cough. It's ongoing cough. That's the issue, right? And whatever, I'm glad they asked, but it's like, please do not exclude people for a 99 temperature and one cough.
Right.
That's not illness.
Right. Oh, hysteria. We're just also
Yeah, it's hard. It's hard, and I think, and again, I want people to ask the question. I don't want them feel bad for thinking that. I just want them to actually say, let's find out an answer from someone who can actually answer that.
Right. Right. Um, yeah, a real pediatrician versus Dr. Google,
Yeah, or honestly, public health departments.
Mm-hmm.
This is the sort of thing that they're fielding, and yeah, I know they're dealing with a lot, right? But this is what their job is, because the far too quote unquote easy answer is to say shut everything down absolutely, and then you leave people in a pickle, right? Like, if well, I got to work, what do I do with my kids? Like, we don't want to overdo it either.
Right. Right. A lot of things to balance. And we're heading into flu season. How do you anticipate flu season will affect all of this?
So first of all, please immunize yourself and your family members. Okay. We do not want to no one wants to be dealing with influenza on top of this pandemic. So the concern is that we have a lot of new hospital admissions and intensive care beds getting taken up, et cetera, in a regular year, simply thanks to influenza. And we could all help that by more widespread influenza immunization. If we have a reuptick in the virus simply due to seasonality, irrespective of everything else we do, because respiratory viruses spread more easily in the winter, the concern is that flu, as well as this virus together, may overwhelm our healthcare systems. Most healthcare systems, some exceptions, obviously New York City, et cetera, but most healthcare systems did not get completely overwhelmed in the US in this pandemic. We've managed to essentially flatten the curve.
Mm-hmm.
We should be going further than that and saying, how do we completely stump out the curve, of course. But the fear is that we'll end up in that situation again of, oh my goodness, all hands on deck. We need every bed we can get. We're tripling the sizes of our ICUs, et cetera, if we're dealing with flu and this.
Mm-hmm.
Having said that, the things we're doing to mitigate COVID-19 also should help with influenza, right? No mass gatherings, don't go to bars, wash your hands, mask wearing, etc. And the limited data we have from the southern hemisphere, whose winter is ending now, seems to be that all their SARS-CoV-2, COVID-19 mitigation strategies seem to also be helping with flu. So we hope that that'll help too. But yes, please help us out here, guys. Please immunize against flu as quickly as possible. Let's see. Today's Wednesday. I got my appointment tomorrow. My daughter's getting hers on Friday, and I think my wife got hers last week, and
Great.
my son has his too. So, please get it done.
Yeah, and lots of workplaces typically give them out, and that's how a lot of people get them. But if without that, because we're all working remotely, people can go to pharmacies and their doctors, right? And there's a lot of options.
Different states have different rules about this, but a lot of pharmacies can do it. There's a lot of places that are starting to say, can we do like a drive-through or something, just because it's even extra important this year.
Yeah. This topic is super important to me, and I feel like I've been hearing a lot of people talk about it, which is great. How is the pandemic affecting children's mental health, and what can we do to support kids going through this? I know adults are struggling with mental health a lot, but I'm the mom of an anxious kiddo, and it's hard to help her through this. And so I'm wondering what you can share about that.
Yeah, and I mean, to that point, how can we support everyone's mental health, not just children, right? It's interesting. There was 2 articles that came out in quick succession in the New York Times, I think, or maybe the Washington Post. I can't remember. One article said, all this cleaning we're doing, it's fine because it makes us feel better, right? It gives us a sense of security, even if we're not really reducing risk. So all this extra wiping down and stuff, It's like we talk about security theater right at the airport, that, well, this is really catching, firearms and luggage and whatever as much as it should. No, but it makes us feel better, right?
Right.
This is idea of sort of health theater or sanitation theater, right? And then like the same day or the next day, there was another article about this, all this cleaning and hand washing and everything is terrible for my child who has obsessive compulsive disorder, because it is, they are now terrified. Like they were talking to a friend outside, masked 10-foot distance, right? So reasonably safe, right? And they spent probably the rest of the day really just anxious about, oh my goodness, what if I didn't do it right? Maybe I'm going to get the virus, et cetera, right? That you know, how do we convey adequately risk and precautions without making people into a gigantic ball of anxiety?
Right.
And I've actually heard this. I was chatting with some library administrators recently who said they have staff who are um, practically, not even practically, they're essentially wearing biohazard suits to empty the book drop. And I said, okay, you realize I wear less protective equipment by far to see live, like, sick children who come and cough on me. I mean, like this is my day job, right? And so there's this sort of, how do you quantify that risk and not create a sense of paralysis, right? I can't do my job, I can't do what I need to, without just saying, oh, it's all fine, right? And yes, we can still socialize, we can do this, right, and do things that are actually problematic. um I'm going to go back to, it's going to sound trite, but I'm going to go back to Mr. Rogers here. Okay. uh look for the helpers,
Mm.
right? What are the people who are actually working on this and have worked on this for a long time? What are they saying? What are they doing? Right? What is their approach to things? Look to people in healthcare. Look to people in public health. Look to the people developing vaccines. When it's easy to think, oh my goodness, it's been how many months? We don't have a vaccine, et cetera. My goodness, we have the single greatest vaccine production effort in human history going on right now. There's something like 200 possible vaccines being worked on. Only 3 are in phase 3 trials, but Mike, 3 simultaneously, you know. And by the way, following good safety standards and precautions and all that. This isn't a rushed slapdash sort of job, right? Um, that is actually incredible. It's a testament to human ingenuity and science. And we'll still have all sorts of things to figure out once something's approved. Like, how do we make enough and get enough out there? How do we convince everyone that it's safe and that they should get it, and so on and so forth, right? There's a lot to come. But that's actually really hopeful. It's really hopeful. I actually think if you think about, like, say, the Black Death in the Middle Ages, they didn't even know what caused it. They had no idea bacteria were not a thing. They had no idea it was traced to rats and things like that. And there was just this sense of fear, and maybe this is the end times, and like the world is going to end, and people, my loved ones are dying all around me, right? Um, we're in a much better place in human history than we ever have been. So, to your question about mental health, I would say that I think it's important to focus on how many people are working and actually being successful, slowly but surely, in making a difference here. Uh, and that there's a lot we don't know, but there is a lot that we do know.
That's really helpful. That's helpful for adults, and if we can internalize that, we can pass it on to the kids that are looking at us and watching us and taking our lead.
I think that sometimes how we react and respond is more key. So back in June, when everyone was going on about, oh, no in-person high school graduations, no proms, all this is awful for the kids, etc. I think there's some kids for whom it was a big letdown and really significant. There's also a lot of kids who honestly didn't care. And I think how we as adults reacted was probably more telling to them than they themselves. My son was one of them. He graduated from high school, and he was like, yeah, didn't really bother him to miss graduation. He was more concerned about how college would turn out and whatever. Yeah, he didn't seem bothered by it at all. And we were like, yeah, that's fine.
Yeah, yeah. My kids use it as an excuse in the beginning to not share with each other because of coronavirus. um, yeah, this has been so wonderful. And we talked about a lot of the different challenges, and you are so hopeful, and I feel better after chatting with you. And you've shared so many places where there are some bright spots within all of this madness. I'm wondering if there are any other that you want to share in closing, any possible silver linings you see in this pandemic.
I think, and I hope we continue to remember how important it is for that we all as a society support one another. Um, Even elements of policy, right? Like the Paycheck Protection Acts and the CARES Acts and all these things, right? That have said, wow, we need to support employees everywhere. We need to support public health. We need to support healthcare. We need to support childcare, um, et cetera, et cetera. All of that, I think, helps us remember that we're all tied up together in I think the term that's often used by orators, right? A garment of destiny, right? That we can't just say it's everyone for themselves. We rely a lot on public goods like public health. And when people ask you, I could have said this earlier when you asked about the effectiveness of masks. I was just also to say that the best PPE, personal protective equipment, is a well-funded, well listened to, and functioning public health system,
Mm.
right? We wouldn't be having this conversation here wondering about masks and blowing through at candles and all that if we had a public health system that tracked and traced and monitored all these things. This is some of the things we've been seeing in Asia, quite honestly.
Mhm.
Um, they've been through the first SARS epidemic. They actually have really good monitoring systems. That's how they were able to catch and tamp a lot of this down much faster.
Mhm.
So I think it helps us learn how much we rely on one another and how some of these public goods, these things that are societal benefits, need to be properly funded and listened to and not just ignored. I think it's a testament, as I said earlier, to scientific ingenuity and how much we can do in a short period of time when we want to. And I think it's also shown us other innovations. I mean, how many of us have become adept at Zoom and WebEx and all these other ways of doing virtual work? And maybe we're seeing innovations in the workplace, right? Around leave, around flexible work to say, hey, we're still able to do all the things we wanted to do, or many of them, without having everyone in a single physical space. Maybe we'll actually reduce people spending time in commutes and traffic and pollution and all that because of that flexibility. I think we still need to be careful that we don't use this as an excuse to
Mm.
say, well, great, we don't need offices anymore.
Right.
Not we can't just dump the work of office space onto everyone's homes. That's essentially a pay cut, right? But for people who want to work from home and actually find it a positive and useful thing or a blend, great, right? That's suddenly become much more feasible.
Yeah.
And in healthcare, right? Telemedicine. I think we've taken great strides in learning how to do telemedicine. It's not going to be appropriate for everything, but there's a lot of things it is.
Right.
So there's a lot of good that can come out of this.
Yeah. A lot of innovation, and just we've given ourselves permission to look at things differently, because we honestly have no choice in a lot of ways. But I agree with everything you said. I think it's just wonderful, and I think that is a great place to end our conversation today. Thank you so much.
Thank you. This is really a pleasure, and I hope for folks out there that they take away not only some practical information, but a sense really of how to continue looking at this crazy, ever evolving situation that we're in. We're all in this together.
Awesome. Well said. Thank you.
You're welcome.